Welcome back, everyone. Welcome back. So, before we proceed with the next, make sure that these participants are in the room with us. I just announced that instead of Meenakshi Sundaram. Sir, before that, you just announced that if the people are in the room with us, these participants. Oh, okay. 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 Okay, sure. So, please, sir. Okay. Um, Welcome back, ladies and gentlemen, again to this very exciting next half of day 4 of IronCon 2025. We hope you're back with energy for more enthusiastic participation. Just like physicians in ancient Kashi, today's neurologists carry that same legacy forward, healing with the heart and intellect alike. With this, I would like to request our respected Dr. Sangeeta Rawat to please take over the event. Ladies and gentlemen, please put your hands together to invite ma'am on stage.
So, good evening, everyone, and welcome to the most popular event of this conference, Barbecue Quiz. And this time we have three very well versed people who have been involved in the MCQs and the quiz since long time. Dr. Rajesh Benny, who is a well known neurologist at Mumbai, and he is a consultant neurologist at Fortis. And also, he is very much involved into the neuromuscular uh, subsection also. And we have Dr. Mayur Thakkar, who is an associate professor of neurology at St. GS Medical and KM Hospital, Mumbai. And thirdly, we have Dr. Vyantesh, who is also a consultant neurologist from Mumbai. And three of them have put up lots of questions together, and we have young minds here waiting for the buzzer to start. And I wish all the best for the winners and for all the participants. Winning is not important. I think taking part is important. And definitely, this will help you in sharpen your knowledge about the neurology and intricacies and where you have to choose one, two, and three. Today's generation is much more smarter in choosing one, two, three compared to our generation where we used to write long lectures. So wish you all the best and over to the team from Rajesh and others. Thank you.
Thank you, madam, for your kind words. And without much ado, we will start this session. We are already 20 minutes late. So, this is an physical quiz session which is going to happen. There will be interactive questions for the audience as well as for the contestants. Obviously, the contestants are prepared. Let's see how prepared our audience are. So, before we start the quiz, I will like to introduce my two co-quiz masters, Dr. Mayur Thakkar and Dr. Venkatesh, who will be joining us on the stage. And I will ask the 8 contestants to come on stage now. Dr. Aishwarya Jirvankar, Dr. Drishti Desai, Dr. Kaniti Saujanya, Dr. Nishant Gowda, Dr. Rami Shetty Sandeep, Dr. Tuhin Santra, Dr. Samik Ghosh, and Dr. Saurav Raja. If you can come on stage, all 8 of you. May I be good? Can you switch the screen? Yeah, phone. Please switch to So this quiz is going to happen to 3 rounds. So we need to choose where we are going to sit. Who is number 1, 2, 3, 4, 5, 6? Because one session there is going to be a passing of the questions. In the remaining two, there is going to be no passing. So we have made a bowl there. Yeah. And you can pick up one sheet and you can sit basis the number which you allotted. You can start with you. Starting from वो टाइमर जब मैं दूंगा तो स्टार्ट करो, हाँ 30 सेकंड्स में। ये अपना नेक्स्ट पे राउंड आएगा वो 8 मिनट का है। ये खत्म होने के बाद में ये 45 मिनट चलने वाला है। लेकिन 30 सेकंड्स में खत्म हो टाइम। लेकिन कोई दिख नहीं रहा, किसको बताना है? ला नहीं सकूंगा है कौन? लेकिन मुझे बोलना पड़ेगा कि टाइमर स्टार्ट और टाइमर एंड, वो क्या कौन करेगा? कौन स्टार्ट करना है? जब मेरी कोचिंग चालू होगी स्टार्ट कौन करेगा? टाइमर ऐसा नहीं, हर एक टाइम करना है उसको। टाइम टाइमर बजेगा, टाइमर बंद होएगा, वापस चालू होगा, वो कौन करेगा? जल्दी बोल, चालू हो रहा है फिक्स। टाइमर तो वैसे हमने क्या होगा, हाँ। हाँ तो अभी बोल, मुझे चालू कर, क्या कर? हाँ हाँ सर, आप चालू तो टाइमर बोलूंगा जब चालू करा। स्विच करो। ऑडियो ऑडियो आया ना स्क्रीन में? Yeah. So before our audience reached, before our contestants reached the stage, we took an online elimination round, and that happened in the month of August. We had almost 337 registrations, and of which 200 attempted the online quiz. And among these, the 8 candidates have been chosen. So a big round of applause to our contestants. It was a tough questionnaire round, and this is how the quiz is going to run. So we have given them chips so that eventually they have chosen their partners, who's going to be first, second, third, and fourth, or luck has chosen their partners. Because in round one, there are going to be 5 questions to each of the contestants. And if one cannot answer, then he can pass it on to the next one. If he passes it on without attempting, then the number that he gets is 0. But if he gives a wrong answer, it's -1. For each correct answer that he gives, it's +4. But if you pass without answering, it goes to the next one. Your score is 0. The next one can attempt if he wants to. He can say pass, and then the question will end there, and then we'll go on to the second question. If he answers a correct one, the question which is passed, he will get +3. And if he answers it wrong, he will get -1. If he passes, obviously it's 0. If the 30 seconds are up, then it will automatically get passed on to the next contestant, and he can decide to pass it, answer it, or leave it alone. So if you decide to answer, if you get a wrong answer, obviously then you will be -1. If you don't attempt anything, it will be 0. Basis upon this first round, you will be ranked. There is no elimination round, so all of you will stay till the end. And after this, we go to the second round. The second round is the one where, with your minds, we want your fingers also to be quick. It will be the fastest finger. So whoever presses the buzzer first will take up the question. But once you press the buzzer, you have 10 seconds to answer. If you don't answer, it is taken as -2. So if you press the buzzer, if you get a question right, it is +4. If you have pressed it and don't answer, or if you answer it wrong, it is -2. There is no passing in this session. So there are only 10 questions in this rapid buzzer. Then we go on to the third round. The third round is the rapid fire, where each of you will be given 1 minute or 8 questions, whichever is earlier. So you can choose to answer all 8 questions, but it should end in first one in that 1 minute. There are no negative points, and you will get only +4. So you can attempt all questions, and there will be no passing of the questions. Each of you will get set of 8 questions. Correct? So the questions have been randomly chosen. So it is not it's been prepared deliberately difficult for some or easy for some. That's the reason why you picked up the cheat. And with this, we will start with the quiz. So I think your contestant number 1, doctor. Your contestant number 1, and the last one is 8. Correct? So, are you able to read the screen? Is the screen okay? All of you, it's okay? Okay, fine. So with this, we start the first round, the first question. And this is the question. MRPI index 2.0 does not incorporate area of the pons, width of the third ventricle, area of the midbrain, width of the midbrain. You don't have to wait for 30 seconds. If you want, you can answer in between. Use your mic. Pass. So he said pass. So the number 2 can pick up the question if he wants to. So he is also passed. So the question ends. So the answer is width of the midbrain. Correct? So the answer is width. So we go on to the next question. So the points are 0 for the first question for contestant 1. Now we go on to contestant 2. Which of the following medications used for migraine prevention is administered as an intravenous infusion? Epotigipant, eptinezumab, erinumab, or fremanezumab? Which of this is administered as an intravenous infusion?
Erenumab.
Sorry,
Erenumab.
erinumab. Can we go on to the next contestant? That's a wrong answer. If you want to answer, you can say pass if you're not sure.
Fremanezumab.
Sorry, you answered something?
Option 4.
Option 4. No, sorry. So the answer is option 2. So both of you get negative points, right? So both of you get negative points. Number 2 gets a negative point. Number 3 also gets a negative point. So the answer is eptinezumab. Oral is atogepant, IV is eptinezumab, and rest remaining 2, that is fremanezumab and erinumab, are subcutaneous. So both of you get negative. We'll go on to contestant 3 for the question. So this is 60-year-old with pain in both thighs, difficulty in up squatting, mildly elevated CK of 800, brisk deep tendon reflexes, most likely diagnosis. Look at the X-ray carefully. This is for contestant 3. CK high, brisk deep tendon reflexes.
Option 1.
Pardon?
Option 1.
Option 1 is wrong. So it goes to the next candidate. If you want to take it, option 3. Option 3. C. Perfect. Osteomyelitic myopathy. Very good. So that X-ray shows looser zones. Very good. So you get +3. Contestant 4 gets +3. Contestant 3 gets -2. We go on to contestant 4 for the next question. Acute ischemic stroke with salvageable brain tissue identified by perfusion imaging who did not initially receive thrombectomy. Intravenous altiplase was administered 4.5 to 24 hours. Provided functional benefit with a mild increase in symptomatic intracranial hemorrhage. Which trial where this conclusion which came from? So this is 4.5 to 24 hours. Attest 2 trial, extend I trial, hope trial, or the race trial. Option 2. Option 2 is wrong. We go on to, so you get -2. We go on to contestant 5. If you want to take it,
Hope trial.
hope trial is absolutely correct. So she gets +3. So we go on to contestant 5 to take her question. So all are features of Kelch-like protein 11 antibody associated paraneoplastic encephalitis, except it is associated most commonly with small cell carcinoma of the lung. Clinical presentation of rhomboencephalitis, tinnitus, and hearing loss. It shows a speckled pattern on immunofluorescence, and possible immunopathogenesis involves cytotoxic T cell mediated harm and neuronal loss. Contestant 5.
Option 3. Speckle pattern on immunofluorescence.
Sorry,
Speckle pattern on immunofluorescence.
can't hear it.
Option 3.
Option 3 is wrong. So you get minus. So you go on to the next contestant, contestant 6.
Option 1 associated with small cell carcinoma.
Option 1 is absolutely correct. It is seen more with the testicular germ cell tumors. Rest of the options were correct. So you get +3. You stay with the mic. Contestant 6 will take this question. So this is a 6-year-old girl with a history of stroke and TIS. This is the MRI which has been given to you. Which is the mutation?
Pass.
Pardon? So you say pass. We go on to the contestant 7. So you get 0.0 for this. Option 3. Option 3. Option 3 is absolutely correct. So that's an ACTA2 mutation, and the typical MRI that you see is the broomstick appearance with a small vessel angiopathy. So answer is correct. Excellent for getting it up. It was a difficult question. You stay with the mic, so you get +3, and this is your question. Lemborexant acts as 5-HT1F agonist, orexin A and B agonist, amyloid light chain blocker, orexin A and B antagonist.
Option 4.
Option 4 is absolutely correct. So you got +4. Very good. Well done. So we go on to the question. First question to contestant 8. 55-year-old presents with progressive non-fluent aphasia and apraxia of speech. Imaging shows left perisylvian atrophy. Which protein is most likely implicated?
Now,
That is option number 2. Option number 2 is absolutely correct. So 8 gets +4. We come back to contestant 1 for the second question. So a 60-year-old patient presents with painful lane-dependent small fiber neuropathy without autonomic symptoms, confirmed by reduced intraepidermal nerve fiber density on skin biopsy. No systemic cause is identified. Which of the following genetic conditions should be considered? Option 3. You said option 3? Yeah, sodium channel mutation. That is absolutely correct answer. Almost 10% of those with idiopathic cryptogenic neuropathy can have a sodium channel abnormality, which can present like a small fiber neuropathy. Correct? So you get +4. We go on to contestant 2 for the second question. A 45-year-old patient presents with acute flaccid paraplegia, sensory loss following a viral illness. Nerve conduction studies are normal, but MRI shows a long segment signal in the anterior horn cells from T10 to L1. Which virus is most likely implicated? Contestant 2.
Epstein-Barr virus.
Pardon?
One option Epstein-Barr virus.
So you said option 1. That is wrong answer. So it goes on to contestant 3.
Cytomegalovirus.
So you said cytomegalovirus. That's a wrong answer. So we pass this. With this question ends. It doesn't pass. It ends. The answer is West Nile virus. West Nile virus infects the anterior horn cell. So both of you have got negative marks. So we go on to contestant number 3 for the second question. So this is 16-year-old male who was diagnosed with cerebral palsy. He now presented with headaches. Examinations showed this characteristic hair loss with trigeminal anesthesia. What is the syndrome called? The clue is in the MRI of B and the hair loss.
Option 3.
Option?
3.
What did you say?
3, sir. Gomez.
3. Yeah, option 3 is absolutely correct. It's a rare syndrome called Gomez-Lopez-Hernandez syndrome, which has this peculiar alopecia called triangular alopecia. Correct. So she gets +4. We go on to contestant 4 with this question, which is 70-year-old with pontine abscess, has CSF showing 800 WBCs, which are predominantly polymorphonuclear cells, low glucose of 35, and gram-positive rods. What is the drug of choice?
Option 2.
Option 2 is absolutely correct. And what is the organism you'd like to say?
Listeria.
Perfect. The organism is Listeria, so you get +4. We go on to contestant 5 for the second question. In a 2.5-year-old, in a 2.5-year-old child with diagnosed genetic spinomuscular atrophy, which is the latest emerging therapy that targets the underlying genetic defect, which is approved for therapy?
Option 3, Zolgensma.
You said option 3 is Zolgensma. The answer is wrong. We go on to the next contestant. I'll tell you why it's wrong. You have 10 seconds to answer or the question ends there. Pass? Fine. So she gets 0.0. Contestant 5 gets a negative point. The answer is nusinersen. Nusinersen is the correct answer because it can be given at any age. But Zolgensma has to be given in a child less than 2 years of age. So the age is more. That's why you can't give the drug. So the answer was nusinersen. We go on to contestant number 6. So the emerging treatment of choice in Mogad, who has relapsed on monthly IVIG infusion. What is the drug of choice? Mogad who's relapsing on IVIG. Okay, pass. We go on to contestant 7.
Option 3.
Pardon?
3.
3 is tocilizumab. Sure, guessing. So your answer is correct. Interleukin 6 inhibitors like tocilizumab are now probably emerging as a treatment of choice in those who are refractory to even IVIG. Tocilizumab is correct. So he gets an extra point for that. We go on to contestant 7. Stay with the mic. And this is your question. A 35-year-old man with spinal cord infarction has acute flaccid paraplegia, dissociated sensory loss, preserved proprioception. Diffusion weighted MRI shows the typical Aulai sign at D10. Which risk factor is most commonly associated with this? Pass. So he gets 0. We go on to contestant 8. If you want to take it, he also says pass. He also gets 0. And 0 means you don't get any negative points. The answer is fibrocartilaginous embolism. That's the most common cause in a spontaneous spinal cord infarction. So we go on to contestant 8 for his second question. 34-year-old male with hemiplegia, cognitive decline, pyramidal signs, ataxia and Parkinsonism. Father and sister had similar history. What is important is the MRI sequence on the left is same MRI over 2 months. So for 2 months, each MRI has been done. From first to last, it's a gap of about 8 months. MRI looks more or less the same. That's your clue.
Option 4.
Option 4 is wrong. It's not correct. Sorry, it's wrong. So we go on to candidate 1 if you want to take it.
Option 3.
Option 3 is absolutely correct. So contestant 8 gets a negative point. Contestant 1 gets an extra point. Yes, it is CSF1R related leukoencephalopathy. It's basically a microgliopathy. And these patients get this white matter signals which remain diffusion positive for many months together. So that's the hint. Diffusion positive which remains like that. So we come to contestant 1 for the third question. All of the following diseases are caused by loss of function or mutation of the SCN1A gene except. All are true except.
Option 3.
Pardon?
Option 3.
Option 3 is wrong. We go on to the contestant 2 if he wants to take this question.
Pass.
So he says pass. So you can keep the mic with you. The correct answer is option 4, early infantile development and epileptic encephalopathy. So we go on to question number 3 for contestant 2. A 38-year-old with HIV with a CD4 of 42 has multiple ring enhancing lesions with an eccentric target sign on MRI. Toxo IgG was positive. He has been given 2 weeks of pyrimethamine sulfadiazine and there has been no improvement. What is the best next step?
Pass.
So he says pass. Contestant number 3, do you want to attempt it?
Brain biopsy.
Which one is the choice? Second one? So yes, that is the correct answer because once you have finished 2 weeks, most of those with toxos should have responded. This can be anything else. You would not like to give more drugs. So you would like to do a brain biopsy. That is the correct answer. So you get an extra point. Contestant 3, stay with the mic. So this is your question. A 62-year-old patient with MSAC has severe autonomic failure and rapid progression. For the heart shows there is preserved cardiac MIBG uptake. So what does this imply? What does this statement mean?
Option 1.
Option 1 is absolutely wrong. We go on to the contestant 4 if you want to take it. He also says pass. The answer is 4 because MSA acts on the preganglionic sympathetic nervous system, not on the postganglionic. So that is how you differentiate PD versus MSA on MIBG, where it will be normal in MISA. The answer is 4. So we contestant number 4, stay with the mic. This is your question. A 42-year-old female with MS on natalizumab develops PML. MRI shows subcortical U fibers involved. There is no mass effect. Which therapy accelerates JCV clearance?
Pass.
So you say pass. We go on to the next contestant, contestant 5, if you want to take it.
Pass.
You also say pass. That's all right. So the question ends. You can stay with the mic. The answer is pembrolizumab. Basically, the best method is first you have to reconstitute the immune system. So you stop natalizumab and give drugs which can reconstitute. Immune checkpoint inhibitors are the emerging therapy for this, and pembrolizumab is a very good drug for that. So contestant number 5, this is a 18-year-old male with refractory seizures and this characteristic MRI. What is the diagnosis? We have put an arrow also to make it easy for you. If you name the sign, I will give you a chocolate.
Option 1, FCD type 2.
You said option 1. Option 1 is absolutely correct. Do you want to say the sign name? It's a transmantle sign. This is very typical for FCD type 2B. Absolutely correct. So we go on to contestant number 6. So this is a 5-month-old child who presents with seizures, hypotonia, alopecia, and eczematous rash. Lab shows metabolic acidosis, ammonia and lactate are normal. Sibling had similar symptoms. What is the diagnosis? See before treatment and after treatment.
Biotinidase deficiency.
So you said biotinidase deficiency. Absolutely correct, doctor. That was a difficult question. You got it correct. So you get +4. So contestant number 7. So this is a 25-year-old male. Long question. Sudden generalized headache for 10 days with vomiting. 2 episodes of focal motor unaware seizures. Right-sided weakness, aphasia. CSF showed 10 cells. Raised proteins but normal sugar. CSF viral panel negative. MRI revealed these findings. What is this?
Option 3.
You said option 3, anti-Mogart. That is absolutely correct. So we go on to contestant number 8 for his third question. So this is a 19-year-old unvaccinated boy bitten by a stray dog 6 weeks now and now has hydrophobia, aerophobia. CSF is normal. What is the gold standard anti-mortem test?
Option 2, RT-PCR on saliva or nuchal skin biopsy.
Option 2, RT-PCR on saliva or nuchal skin biopsy is absolutely correct. You get +4. We come to contestant number 1 for question number 4. 58-year-old patient with a 8-year-old disease course presents with asymmetric rigidity, dystonia, alien limb phenomena. CSF shows normal A beta 42, high total tau but low P tau 181. Autopsy reveals astrocytic plaques, balloon neurons. Which gene is most likely mutated? Something on pathology and genetics.
Option 1.
You said option 1, and option 1 is absolutely correct because this is CPGD and it is because of 4R tauopathy where you get higher levels of MAPT mutations. Answer correct. Very good answer. We go on to contestant 2, 18-year-old with refractory seizures and this MRI. What is the diagnosis?
Option 4.
Pardon?
Option 4.
Option
4.
4. Option 4 is wrong. We go on to contestant number 3. So you get -1.
Pass.
So you say pass. The answer is tuberous sclerosis. This is a radial band sign. It's a very typical sign, and you can see one tuber also on the left brain. So answer was tuberous sclerosis. So we go on to contestant 3. The neuromodulation device, non-invasive vagus nerve stimulator, is FDA approved for which type of headache?
Cluster headache.
Sorry?
Cluster headache.
Option 2. Option 2 is correct. It is cluster headache. So you get it right. Congrats. We go on to contestant number 4. A 3-year-old child presents with recurrent absent seizures, developmental delay, and intermittent episodes of unsteadiness, particularly before meals. CSF glucose is 30, simultaneous blood glucose is 85. What is the most likely gene deficit responsible for the disease in his condition?
Option 2.
Option 2 is wrong. So we go on to contestant number 5, if you want to take it. Contestant 5. Pass? You say pass? Okay. So the answer is 3, SCLC2A1, because it encodes for the GLUT1 receptor. This is a GLUT1 deficiency syndrome, which you must have most likely guessed. It's a difficult question to answer. So contestant number 5. 45-year-old with HIV starts ART. CD4 immediately jumps from 48 to 210. 6 weeks later, worsening hemiparesis, new contrast enhancement on MRI. JCV PCR has now dropped from 5.6 to 3.1. What is the diagnosis? Lab parameters improved, but he worsened.
PML iris.
You say PML iris, choice number 3. That is the correct answer. It was a relatively easy question for you, but well done. Contestant 6. Which of the following is a key distinguishing feature of frontotemporal dementia with C9orf72 mutation compared to sporadic FTD? Does contestant number 7 want to try?
Pass.
You say pass. The answer is, so both of you get 0. The answer is increased prevalence of psychotic symptoms. You get more evidence of psychotic symptom if you are C9orf72. Contestant number 7. This characteristic sign on MRI may suggest the diagnosis of. There is a name to the sign and the choices. The clue is the sequences.
DNET.
You said DNET. The answer is wrong. Contestant 8. So you say pass. So 7 gets negative, 8 gets 0. And this is a T2 weighted flare mismatch. Initially, it was thought to be of pathognomic of glioma, which is IDH mutant type. But it has been seen in all these types that it is there. It's seen even in DNET and even in wild type. The answer is all of the above. Difficult question. This is for contestant number 8. The select scoring system is useful to predict what?
Option 3.
Pardon?
Option 3.
Option 3, you said. Option 3 is absolutely correct. It is a scoring system to tell you what is the risk of getting post-ischemic seizures. Now there is a Select 2.0, which gives you the risk that the patient may have seizures later on. Answer is absolutely correct. We come to contestant number 1 for the last set of questions. So a 29-year-old contestant number 1, a 29-year-old with seizures has 2 viable parenchymal cysts more than 2 centimeters with scolex with perilesional edema. CSF showed 18 eosinophils. There is no extracranial evidence. What is the classification of this neurocystic cirrhosis. So we're using some criteria. Option 3. You say option 3, the answer is wrong. Contestant 2.
Option 1.
Option 1, answer is wrong. It is definite. So the answer should, both of you get minus points. The answer should have been definite based upon the Del Bruto 2024 criteria. Even 2 with a viable cyst and scolex is enough to call it NCC. So you keep the mic. This is for contestant 2, 50-year-old patient with SOD1 ALS, which has this peculiar mutation, D90A homozygous, slow progression over 8 years. Which therapy is FDA approved for this variant?
Option 1, Tofersen.
Option?
1.
You said option 1. That is wrong. We go on to contestant number 3.
Option 3.
Option?
3.
You said option 3. Answer is wrong. So you keep the mic. The answer is none. Because when you have this mutation for SAD1 ALS, you can't use Tofersen. If this mutation is not there, only then you can use Tofersen. Because with this mutation, anyways, the disease is slow to progress. So it was excluded from the Valor trial. This is for contestant number 3. The ventral spinocerebellar tract decussates twice. Where is the second decussation? Easy answer.
Superior cerebellar peduncle.
Sorry,
Option 2.
you said option 2. Option 2 is absolutely correct. Good guess. So you get the correct answer. It is superior cerebellar peduncle. So contestant number 4. There are 2 characteristic signs on this MRI which suggest a particular myopathy. Which is it? Arrow has been put.
Option 2.
You say option 2, calpanopathy, it's wrong. Contestant 5, do you want to take it? You are playing absolutely safe. Pass or you want to answer?
Collagen 6 related myopathy.
Sorry, what was it?
Option 3. Collagen 6 related myopathy.
Option 3, collagen 6 myopathy is absolutely correct. What you see on the ventral surface is actually the rectus femoris with the target sign. What you see on the lateral thing is the vastus lateralis with the sandwich sign. It's very, very typical for collagen 6 myopathy. Answer is absolutely correct. You stay with the mic. So you get +3. And the question for you, exploding head syndrome is classified as what?
Option 1. Cluster headache variant.
So option number 1 is absolutely wrong. So we go on to contestant 6. So you get -1. You say pass. So though it's called as exploding head syndrome, it is not a headache at all. It is a hallucination of headache. So it is basically a parasomnia. So there is no pain involved here. Pain only to you all. So you stay with the mic. All of the following about vigabatrin are true except
Option 3.
option
3.
3.
No effect on.
Option 3 is absolutely correct. It does have effect on behavior and that too it comes very early with the use of vigabatrin. So you're correct. So you get +4. So we go on to contestant number 7. A 2-year-old child with normal birth development history presented with an acute febrile encephalopathy on examination has generalized dystonia, macrocephaly, intermittent seizures, ophthalmologically has intraretinal hemorrhage, and this is the MRI which shows the typical features. What is the diagnosis? Forget the history, see the MRI. So you say pass. We go on to the next contestant if you want to attempt it.
Option 1, butyric acidemia type.
Option 1 is absolutely correct. Very good answer. So you stay with the mic, you get +3. And the last question of this round goes to you. A 50-year-old patient presents with ptosis, ophthalmoplegia, and proximal weakness. Muscle biopsy shows ragged red fibers and cytochrome C oxidase negative fibers. Which genetic defect is most likely?
Option 1, single large scale mitochondrial DNA deletion.
Option 1 is absolutely wrong. We go on to contestant 1 if you want to take it. This is the only pass which will happen if you want to take it.
Option 4.
Option
4.
Option 4 is wrong. So you get, both of you get -1. The option is 2, Paul G mutation. First one is Kansai actually. So with that, we come to the end of session 1, round 1. And when my co-people are trying to give you the scores, I will have some quiz for the audience. So unfortunately for the audience, we don't have a buzzer, so you can shout out the answer. I would like to show you a video first and then the question. It's not coming up. Nothing is coming up on screen. Video is playing here, it's not coming there. Video is not showing. Audio. So why I'm showing this guy running? No audio? I'll need audio for the remaining videos.
I'm not sure.
So why is this person in the video and photo relevant to neurologist? He came in this Sports Illustrated, which was way back in 1954. The name of the sports person is obviously written at the top of the magazine, Roger Bannister. So why is he relevant to us? What is the answer?
He's a neurologist.
He is a neurologist is correct, but among these choices, which one would you like to attempt? We know he's a neurologist.
Yeah. Acid deficiency.
But I'll tell you a story. How did you become a neurologist?
I think it will be all of the above.
Anyone else with any other answers? Or Dr. Amit gets the chocolate? Option 3. Someone said option 3. Option 3 is wrong. So the correct answer is option 4. Right? Most of us love to run. Yeah. So this was way back in 94 when he was actually a 25-year-old MBBS student. And he was at the crossroad that should he pursue a career in sports or should he continue with medicine? And then he did a physiologically impossible task, which was called as running a mile in sub 4 minutes. In all these years, till 1954, no one has ever done it. And he does it for the first time. So he decides that he's going to be a sports person. He starts training for the Olympics. In the next 6 weeks, his record gets broken down by 7 different people. So once someone breaks it, the other people get the confidence to break the record. He gets so disheartened by this sport, he goes on to become a neurologist. He goes on to go into autonomic nervous system. In fact, he is probably one of the founder members of autonomic nervous system labs in the whole of the world. And his student was C.J. Matthias. And many of the papers that you see on autonomic nervous system are either by Roger Bannister or by C.J. Matthias. He also founded the MSA, the Society for Multisystem Atrophy. So he died recently 7 years back. So this is Sir Roger Bannister. So he says, however ordinary each of us may seem, we all are in some way special and we can do things that are extraordinary. Perhaps until then, even which was thought as impossible. Such a good thought, right? So even you can do things which are told by your bosses that they are impossible. We'll try the audio. We'll try audio. एक question Obviously, other than the obscene display of the near perfect body that he had, obviously we are not going to discuss about that. So why did we show this? Oi. So where is the site of the lesion that explains Amir Khan's issue? So the question was, the video was actually to give you a hint. Where is the site of the lesion that explains that? Where is Amir Khan's lesion? Anyone wants to volunteer? No, all of the above is wrong. How can you all of the above?
Hippocampus. Hippocampus.
Doctor, which one?
Hip-
Option?
One. Option one.
Option 1 is wrong because he was doing something. He had written something on his body. What is that?
Bodies.
Huh?
Mammillary bodies.
Wrong. Madam gets the chocolate. So because he was using cues, right? He had written visual cues, somatic cues. That's how he could remember. So the site of lesion was the prefrontal cortex because this was a memory which was improving with the whole movie keeps on reviewing cards. So he was relying on his memory to improve with visual cues, auditory cues, even the cues which he had written on himself, which a person with Alzheimer's disease with hippocampal abnormality will not be able to do. The site of lesion is the prefrontal cortex. Thank you.
Thank you so much.
Well done, madam. Well done. So we'll go back to the serious matters at hand. And so contestant, okay. Contestant number 7 and 8 are tied at 13 points. Contestant number 5 and 6 are again tied up at second point with 11. And contestant number 3 is got 10 points. Yeah, but still there is a long way to go. So we go on to the next session. Oh. Yeah. So now this is the buzzer round. Okay. So it is not only a skill of your brains, it is also a skill how fast you will touch the buzzer. But for buzzer, please excuse us. We will make the decision if there is any controversy who press the buzzer first. Okay. So you can trust us. We'll try and neutral as much as possible. So it is a rapid round. There are negative points for this round also. The negative point is -2 and the positive is +4 and there is no pass. Once you choose, you have 10 seconds to answer. So I think so everybody's ready. I'm audible? No, you can check. You can check if you have any doubts. Press and check. This is not working. Six number not working. Ah. Right. So I will just I will just wait for this. So we'll be starting with buzzer round. So everybody ready with the buzzers? So I will be reading out the question. At the end of completion of my reading, your time starts.
So I will be reading the questions. Am I audible? Yeah. So question 1, 49-year-old female, present acute meningoencephalitis. What is the diagnosis? Option 3, G5 astrocytopathy. 3, so G5. Correct. So the answer is 3, G5 astropathy. Second question, according to the latest. Yeah, but still I will be reading out the questions. But you can press the button. Right. You can press. Press the- So everybody is ready now. So we'll go to next question. Second question, according to latest IHS guidelines, which is not a first line treatment for prevention of migraine headaches?
Amitriptyline. Amitriptyline.
No, wrong. So the answer is valproate. Now question 3. The following are special situations in which patients with hyperacute ischemic stroke are eligible for IV thrombolysis as per AHA guidelines with at least 2 recommendation except number 5. You have 10 seconds. Take a mic. Mic.
Intracranial vascular malformation.
Correct. So second is the answer. Correct answer. Correct. Question 4. CSF biomarker showing strong evidence, particularly for monitoring axonal damage and treatment response. Number 1. He is already pressed. Option 2, neurofilament light chain. Option 2. So answer is correct. So we'll go to next question. Question 5. 30-year-old lady with painful cramps, progressive amenorrhea, and gastric cutaneous abnormality. Number 1. Option 1. So option 1 is wrong. So answer is Satoshi syndrome. So negative points. Next question. Oral cannabidiol is FDA approved for following indication except number 8. Don't press. Number 8, let him answer. Dravet syndrome. You said Dravet syndrome? Answer is wrong. Refractive infantile spasm. So answer is 3. So we'll go to next question. Be ready. Identify the disorder showing this sign on MRI. Number 8. Joubert syndrome. Joubert. So right. The answer is 2. Joubert syndrome. Next question. This MRI is typical of. Number 8. Neuromyeliosis. Answer is right. Answer is second. Neuromyeliosis. Next question. Be ready. All are true about the use of tocilizumab except number 1. Option 2. Correct. So it correct answer is option 2. Plus point. The next question. In Alzheimer's disease, which biomarker profile in CSF is most consistent with the diagnosis? Number 8.
10 seconds.
Option 1. So option 1. It is right. So plus point. So we are complete with the second round. Buzzer.
Great. Excellent. Good show. Good show.
So you yes.
So till the time Dr. Mayur is getting the contestant ranking ready, we will go back to our quiz. So we will see much more trailers now.
You will be working with patients, people, doctor. You say people. Do you mean living people? It's all a job, don't you? I'm left to say it. I need it right now. That's it. Born in 1911 in Kingsbridge, New York. Prior to July 1955. Resided in psychiatric center, Brooklyn, New York. Wow, thank you, Trash. Trash! Thanks. It gets easier. You don't think it will, but it does. You hear me? Does he ever speak to you? Of course not. Not in words. No shame to do the 9/11 for you. Your patients, doctor, haven't moved in decades. No, these people are alive inside. How do you know that, doctor? Just wanted to say to you. Tomorrow, maybe you need science. Snacks, the miracle. It's on your face. I could deal with losing 30 years of my life, could you?
So this movie was the movie Awakenings. Correct? So someone is already ready. Based on patients with mic for them. Pardon? Number 3. Number 3. Post-encephalitis lethargica. Yes. Who was the young actor? Robert De Niro. Correct. So this is von Ecomo's disease, post-encephalitis lethargica. But that is not the real question. The real question is, who is the doctor which Robin Williams is playing? Yes, the doctor is Oliver Sacks. So this is a novel called The Awakenings, which has been written by Oliver Sacks, who is a neurologist. So he has got his experience of treating patients with neurological and psychiatric disease, where he has made it into a movie. It was actually nominated for the Oscar. And that is not the only book that he has written. He has written this book also, where he has written 40 essays. The most popular one is The Man Who Mistook His Wife for a Hat, based on a patient who had visual agnosia. And he's been called as the poet laureate of contemporary medicine. Correct. There is a series called Brilliant Minds playing on Netflix. How many of you are seeing it? The main protagonist is actually Oliver Sacks. It's based on Oliver Sacks. So he's a very celebrity neurologist. That's all. So we neurologists are going places other than to only INNAN. Now look at this famous photo. Wait. Let me ask you the question.
So who all do you see in the photo is the question. See the photo carefully. There are many people. Huh? Are you sure? Are you sure Tourette is also there? Is Tourette Sharko's student, Sharko's enemy, contemporary, senior? Pardon? Someone said student. Can you take the mic, sir? This mic, hand mic, anything is okay.
He was a student.
Yeah, he was a student. You're correct. All of them were students, and you can see all the famous ones. Babinski, Charcot at the center. Then you have Parinaud, you have Bonville, the one who described neurofibromatosis, the Tourette guy, Tourette syndrome, and all of them are big guys. All of them are big guys. But that is again not the question. The question is, who is this lady? Who is this lady? Before I go on disclose who this is, do you know the story about this lady? So this is the most famous big painting. If you go to La Salpêtrière at Ivry in France, that's where I went for my neuromuscular thing. You will see a big painting of Charcot with this lady in his arms. He's demonstrating hysteria to his students. He's the one who's coined the word hysteria. But who is this lady? And why is she the center of this movie? So she is Augustine. She is actually a very beautiful teenage maid who Charcot falls in love with. So much so, he becomes almost a person who gets obsessed with her. But it's a one sided love. And he cures her. And in the movie, she actually runs away from him. So the name of that lady is Augustine. And this was an extramarital affair which actually took down the whole of European neurology because he was considered as the godfather of European neurology at that time. So she is Augustine. So we'll go on to more serious matters at hand.
Okay. Okay. The 8 is first.
At the end of round two, uh, contestant number 8 is on rank 1 with 23 points. Contestant number 5 is on rank 2 with 14 points, 15 points, sorry. And contestant number 1 is on third position with 14 points. So you're very close by. Fine. We go on to the last round then.
So good evening, everybody. So now we have each contestant will have 8 questions maximum which they can answer or 1 minute, whichever is earlier. So it depends on you. If before my completing the question, if you want to answer, you can directly answer. So we will start with, and this is not possible. You are able to hear me now? Yeah.
So asking any number of questions you want to attempt. You don't have to wait for the question to be over. No negative points. No.
So each will get 8 questions maximum or whatever time in 1 minute they can have. Okay. And not possible. You can answer even before my completing the question. So we'll start with contestant number 1, 32-year male, presented with encephalitis after stem cell transplant. So,
HHV6.
okay, it's correct. Which CGRP and monoclonal antibody binds the receptor instead of ligand?
Option 3.
Sorry, P. Erinumab, correct. 38-year-old woman with psychiatry symptoms who developed severe cognitive impairment, myoclonus tremors, chronic diarrhea, profound weight loss. What is the diagnosis?
Option 1.
Okay. All of the following are true about vamorolone except
Pass.
pass. Sorry, pass.
Pass.
Which of the following genetic mutation is most commonly associated with familial ALS?
Um, SOD1.
SOD1. Wrong. The anterior parietal artery supplies lateral geniculate body by which branch?
Option 3.
Option
3.
correct. 32-year-old obese female with IIH, vision of 6 by 12, improved after therapeutic LP, started on medications and developed acute painful vision loss in 3 days. So, what is the cause?
Option 4.
Wrong. So, time up, I think. 1 minute is up. So, you completed 7 questions and we have to pass on this 8 questions. So, now contestant 2 will have 8 questions. Can we start? Yes, great. Dentatorubrophthalamic decussation decussates in superior cerebellar peduncle. Where does it synapse in thalamus?
Pass.
Pass.
Ventrolateral second.
Okay. Lesion of anatomic structure causes alien hand plus intermanual conflict.
Two. Parietal lobe.
Corpus callosum, so wrong. 20-year-old male had progressive ataxia, spasticity, and polyneuropathy from childhood. What does he have? What do you see in the MRI?
Second. Arscus.
RSS is correct. PFO is found in what proportion of ESS cases and it's implicated as a cause for embolic stroke among what proportion?
Pass.
Pass. 5-year-old female with sleep-related non-febrile seizures at 3 years and 5 years psychomotor regression, loss of drawing skill, language.
Second. Landau-Kleffner's.
Landau-Kleffner. Drug causing reversible posterior leukoencephalopathy.
Tacrolimus.
Tacrolimus. All of the above. Second intravenous immunoglobulin course should not be considered as for treatment. So I think he answered 6, 7. So we go to contestant 3 now. Okay. So contestant 3, start. Which molecule is most implicated in the pathogenesis of ALS? TDP-43, tau, beta amyloid, alpha synuclein.
TDP-43.
Correct. Second question, which part of internal capsule carries corticobulbar fibers? Anterior, third, middle, posterior. Wrong. Third question, which mutation is most commonly associated with familial Alzheimer's disease with early onset?
LRRK2.
Wrong. What is the most common genetic mutation associated with familial spinocerebellar ataxia type 1?
CAG. 3.
Correct. Invasive MRI technique to detect penumbra. Next. Anti-Iglon mediated disease can be. Sorry?
3.
3 is wrong. So contestant 4. Are you ready? Yeah. So start. All of the following NBIAs are inherited autosomal recessive patterns except
Option 4.
4. Correct. The following can be associated with this clinical sign. You can see the clinical sign on the photograph.
Option 2.
Option 2 is wrong. The substantia nigra pars reticulata projects to thalamus via which fasciculus?
Option 2.
Correct. A 20-year suddenly developed sensation that his body was suddenly enlarged and changing shape, suffering from.
Option 1.
Wrong. Most common cause of recurrent thunderclap headaches in less than 60 years.
Option 2.
Wrong. Who used the reflex hammer for the first time?
Option 3.
Option C. Yeah, it's correct. So he missed two questions. Contestant 5, ready? Start. All of the following statements suggest AHA guidelines class 1 recommendation for IV thrombolysis in acute stroke, except
Option 3.
option 3 is wrong. Fast ripples on EEG have frequency of
Option C.
it's correct. In Huntington disease, loss of medium spiny neurons in striatum is primarily driven by which molecular process?
Option 2.
Option 2, wrong. Rapid cerebellar ataxia and this sign on MRI. You should suspect
Pass.
the posterior limb of internal capsule is bounded medially by which structure at level of thalamus? You can take the answer.
Option 2.
Option
2.
2 is wrong. So you missed quite a lot. 6, contestant number 6. Ready? Yeah, we can start. Anti-CRMP5 is most commonly associated with which malignancy?
Small cell lung carcinoma.
Correct. The sign most likely suggests
Pass.
pass. 6-year-old girl with progressive gait and steadiness, distal weakness, and tightly curly hair.
C. GANC.
GNC. Correct. Which of the following is most likely mechanism for selective vulnerability of dopaminergic neurons in substantia nigra, pars compacta in Parkinson's disease?
1.
Correct. Who is considered father of neuroscience?
Charco.
Wrong. The MRI sign seen in normal on gradient.
Pass.
Pass. All are true except all are true about the anti-titin antibody in myasthenia gravis except
2.
2 is wrong. So contestant 7,
Yeah.
ready?
Yes.
So start. The habenular commissure connects with two structures. Left, right, habenula, habenula and pineal, habenula amygdala.
3.
3 is wrong. Most lacunar syndromes have been described by
4.
4. Wrong. Link the most likely antibody associated with this cutaneous finding.
Option 2.
Sorry?
2.
2 is wrong. In which congenital myasthenic syndrome pyridostigmine is to be avoided?
One.
Wrong. Which of the following drugs have been approved by US FDA for first-line treatment? Correct. Simple clue that fibrocartilaginous embolism is cause of cord infarction.
1.
1. Wrong. Physiological basis of finish. So contestant 8, ready? We'll start. The MRI sign associated with
Both of the above.
wrong. Myotonia without weakness is seen in
All of the above.
correct. Reverse SLR LE sign is associated with
All of the above.
correct. Following etiology can be responsible for this interesting finding.
Hansen's.
Wrong. Muscle of facial expression were studied by Faraday's. Sorry.
Induction.
Correct. Geniculocalcarine tract has a lower loop that passes inferior to temporal horn. Which structure forms its medial boundary?
Option 4.
Option 4. Wrong. Diagnosis of this child.
Schwann-Stensel syndrome. Option 3.
Correct. So it's correct. So most of them were able to answer around 5, 6 questions, and we'll come with the scores. Till then, Benny sir will take over.
Question for the audience. Who is this? What is the correct answer? The lady at the back. Pardon? Okay, correct. So you get the chocolate. So this is Chris Hemsworth, who plays Thor in the series. He's also actor in Extraction series, and he's got a genetic predisposition for AD, that is the ApoE4 variant, and it confers a 8 to 10 times higher risk than developing the general population. So what does he do? He stops making movie for a year, takes a sabbatical, and spends time more with the family to be socially connected.
That's the past 6 months. Why you go with the man? What's up? Well, out of here, all to carry that. But I have no idea he's in charge. Radio silent. Sorry, I didn't get that message. Hey, Nathan. All signs of disturbance dispatched. Mr. Cowboy. In there.
So what pathology would this actor who said these famous words, EPEKI, have? Synuclein, neurofibrillary tangles, tau, all of the above. A tau for the person in the coat, he gets the chocolate. So what he has is a non-fluent version of the progressive primary aphasia, and he's been diagnosed with this dementia since 2022. That's Bruce Willis, and all of you know him through many of these films that he has. You should definitely see Sixth Sense if you have not seen it, and many such movies which he's made. So he's an iconic actor. So this I will leave it for the end after I announce the prize, just to get you inspired. So I'm sure Dr. Mayur is here with the final list. Yeah. So it was a tough competition, and all of you are very, very good. Forgive us if we could not have arranged it much better for you all. And the first prize goes to contestant 8, Nishant Gowda, with 39 points. Congrats, Nishant. Can you stand up, please? Contestant number 2, rank number 2 is contestant 1, Dr. Tuhin Santra, with 30 points. And rank number 3 is contestant 6, Drishti Desai, who is third with 21 points. Congrats to all of you. And we have a token of appreciation, I think, from Torrent Pharma for all the participants. May I ask Dr. Sangeeta Rawat Madam to felicitate all our contestants. All the 3 prize winners will have to wait for tomorrow for the validatory function to get your awards. But congrats to all of you. It was a very tough competition. You all lost by 1 or 2 points. Madam Sangeeta Rawat Madam, if you can come and do the honors. Yeah. Yes. Can we get the books? Books. Ah.
So this is contestant number 5, Aishwarya Jirvankar. Contestant number 6, Rishti Desai. Next. Next is contestant number 8, Nishant Gowda. Next is contestant number 7, Rami Shetty Sandeep. Next is contestant number 1, Tuhin Santara. Yeah, 30. Next, contestant number 4, Samik Ghosh. Tuhin Ghosh. हाँ निशांत गौड़ा दिया नहीं दिया था हाँ एक मिनट निशांत गौड़ा का दिया है कंटेस्टेंट 8 8 ठीक बॉस निशांत निशांत अब छोड़िए Three people are in it.
Swami बोलते I would request all the contestants to wait and not leave, please. All the contestants, please wait. हाँ सबके सर yes all contestants can you come on the stage I will leave the video screen switch करो screen yes ma'am
Los resultados nos hacen pensar que estamos dentro de una enfermedad llamada esclerosis múltiple. La pierna derecha. La pierna derecha. No podéis comer a veces podrá hacerlo solo. Ya sé que no os lleváis muy bien, pero hazlo por mí. Venga, vamos a hacer 100 metros.
Congratulations to everyone who participated, and I think big congratulations and I think for the people who conducted this and worked very hard for last 2 months. So Rajesh, who also has a beautiful other, others. I think that was very interesting. All the movies and who has got the neurological disease. That was very interesting thing. Dr. Mayur, Rajesh, and Venkatesh, who worked very hard for putting up these questions. Big round of applause to all three of them. And also Foreign Farmer for doing this every year and made me change to the plenary hall for this. Thank you very much for doing this every year. Thank you. And I hope you continue doing it.
So before we sign off, this last trailer is from a movie called 100 Meters. This is a sports person who's been diagnosed with multiple sclerosis and who's been told by the doctors that over the next 1 year you can walk only for 100 meters. So what does he do? He goes on and does a triathlon. And triathlon is 3.8 kilometers of swimming, 180 kilometers of cycling, and 42 kilometers of running, which he finished in 2013. So this message is for us. Giving up is not an option. Thank you. Thank you very much.
Thank you so much, respected dignitaries, quiz masters, participants, and our dear audience for that yet another energetic session. Let's remember, ladies and gentlemen, you are in Mahadev's own city, Kashi. गंगा और घाट की काशी, रंग भंग और ठाट की काशी, महाशमशान और मुक्ति की काशी, अमर अविरल अविमुक्त है काशी. चाहे कहो ये काशी या वो काशी, प्रलय से पहले थी काशी और प्रलय के अंततः केवल काशी. And for everyone else, these lines basically summarize everything from ghats, colors, life, death, enlightenment, and